All right. Welcome, everyone, to our latest Scale Community podcast. We're joined by Anthony Milonas. Anthony, am I pronouncing your last name correctly?
Right, absolutely.
Okay. Anthony joins us as the CEO of Ascend Aesthetic, which is an incredibly fascinating business in a space that is really going through transformation. We will dive into that. But before we do that, Anthony, why don't you describe your journey that led you to this position at Ascend?
Perfect. I'll give you kind of the 2 minute view. So, first of all, I'm Canadian and moved to Atlanta, Georgia, to take on this role. But I think my journey in healthcare started back in 2010. I was based in Europe, working at a distribution company where it was going through a pretty massive turnaround. It was a US based distribution company that had operations in Europe. And I felt like my life was meaningless, had no purpose, and I felt like it had very little impact on the outcome of people's lives. So it was my first journey into healthcare. I got into home health, moved back to Canada, and since then I've been in healthcare companies. And the reason why I picked healthcare was because I felt like it had a larger impact, no different than the company I'm at now, which really helps people live their optimal best selves and best lives. And I ended up here because I worked for an organization that specializes in building healthcare companies in Canada, and they felt like I'd be a good fit here to help build Ascend from scratch. So that's why I'm here and loving every minute of it.
Thank you. Tell us about Ascend.
Sure. Ascend's got, I'll give you a quick 30-second view on our focuses and what makes us different. First of all, we got together as a group of doctors. So our inception was October 25th, 2023. That was 5 practices with 5 locations. We brought our key doctors together and wanted to focus on ensuring that it was doctor-led. So we decided to start from what we wanted to build backwards. So our first order of business was to build our purpose, vision, and our values. And that happened late November 2023. And it was based on the input of all of our founding doctors. So our purpose is to guide patients on a journey toward their optimal selves, to renew, restore, and foster self-confidence. And our vision is to really establish a cohesive alliance of plastic surgeons committed to excellence in aesthetics, with comprehensive and compassionate care ultimately recognized as the premier centers of excellence. Our 5 core values, which we came up with, was excellence, compassion, community, accountability, ultimately leading to building a winning team. And all of that has guided our, strategy development. And, if I walk through our 4 pillars in our strategy, the first one is building community, collaboration, education, and unity. We really want to make sure that we protect and ensure that we're doctor-led. In order to do that, if you go to our website, you'll find that each one of our doctors participates in an advisory group for each function. They help us advise. They also dig into key topics that protect what they want to protect the organization from doing things that aren't aligned with their values and our values. One of our doctors put it perfectly. When he joined Ascend, he said, "Anthony, all I want to do is keep it classy." Our 4 pillars, building community, collaboration, education, and unity. That's a key piece. Ultimately, we've got to be able to produce information that allows us to get better, drive operational excellence. And that just doesn't mean driving income and financial outcomes, but also ensuring that we've got the highest standard of quality in the industry. And that is one of our key goals and at the top of our scale, ensuring that we develop leaders and strengthen governance. We do training programs for each function, our practice leaders, and our doctors quarterly, and drive market expansion. So we are continuing to bring on new partners with a pretty full pipeline as well as build out new ORs in key jurisdictions, and also build out a med spa. Our organization is roughly 70% plastic surgery, and it's plastic surgery led, and about 30% med spa. I
So
don't know if that
let's
answers your question, Roy.
yeah, let's dive into a little bit. So when you came together, you brought practices from Florida, South Carolina, Alabama, New Mexico, and Utah together, and you did so with the aid of, I think, Sheridan Capital as a private equity partner, forming an MSO in predominantly the plastic surgery space. What Put that in context. I mean, plastic surgery, as we've all grown up with, is a small one, maybe two physician practice type industry. And so that is transformational. I think making you day one, the largest, most national footprint practice surgery MSO in the country. What are you seeing out there for the rest of the industry? Are other MSOs forming, similarly using private equity capital to drive consolidation? Who are those other groups? What makes Ascend different from those groups? Is it patient demographics? Is it geography? Who are your patient demographic focus customers? How are you viewing the industry at large?
Thank you very much for that question. So I'd say a couple things. So first of all, I don't want to speak too much about our competitors because they've got their own strategy, and respectfully, they'll have their own view on things. But I will tell you from my experience, I've worked with 5 or 6 different private equities. So let me deal with that question first. Not all private equities are created equal. The one thing that makes Sheridan attractive to me, because I've worked with them in the past, and that's how I ended up here, is they have a number of physician-led practices. They understand that healthcare has to be led and grounded in quality of healthcare, and also understand that creating an environment where we give autonomy to our doctors to provide support, care, and input to our strategy is key. Others have an idea, and the other big thing with Sheridan is we are very growth oriented. So we will never go in an organization and reduce headcount. In actual fact, we do the reverse. We create a large amount of investment in our infrastructure. So for example, in our practice in Linden, Utah, we're building out 2 additional ORs. In our practice in Tallahassee, we just finished the building out of a med spa that hangs off of Tallahassee Plastic Surgery. In Jacksonville or Ponte Vedra, we're building out another OR in one of their offices. So we are very investment focused and drive growth to create value for our investors. And I always characterize, our financial partners just that, our financial partners. But the important thing to recognize with any private equity is that they're not all created equally, and understanding what a physician-led practice looks like is certainly key to our, to our development. Your second question around, patient demographics, I would really say that, our focus obviously is to grow and to grow our top line revenue and ultimately creating a better top line or bottom line. We do it 3 ways. So our first priority is not to ask our doctors to do more, which is often the case with a lot of private equity-led platforms, but just to do the same, right? And it's our job to ensure that we drive marketing to ensure that their schedules are full. The demographic that we focus on predominantly is obviously women from the ages of 35 to 65. Of course, now we're seeing larger growth in the younger population, specifically in the med spa area. And although we're doctor-led, we understand the importance of having the med spa piece, which helps build the plastic surgery piece, and vice versa. In essence, it's a flywheel of referral. When people are ready for plastic surgery, we're there for them. And once they're done their plastic surgery, it's often very important to continue a maintenance regime through our med spas. Our focus is buying plastic surgery practices or partnering with plastic surgery practice and creating that community with doctor-led, board-certified surgeons, and then adding and developing med spa services going forward, more like a de novo type environment.
Understood. So let's get into the actual operations of it. I certainly take the point that it's physician-led and certainly take the point that you're growth-oriented, but really want to get into the weeds here of the operations. So you're picking up small practices that historically, for decades, have been run by one or two individuals who think that they are best in class in marketing and really are the go-to brand in their local market region. Why are they excited to work with you operationally? What have you done for them? What do you plan to do for them in respective departments like marketing, recruiting, analytics? What are the guts of the operations that you see a significant contrast between a national operation and a local physician-led practice?
That's a really good question, and thank you for that, Roy. I would say three things. Number one, it's all about our community. And what I mean by that, it's sharing best practices, learning from one another. We bring our physicians together once a quarter in our clinical advisory board, so they could share most effective ways to do surgeries. The second big piece is professionalizing with information. So it's easy to believe that you're the best, but in most cases, and our chief medical officer, Dr. Bill Hedden, will say this, all of them are successful by their own right, but they've never really measured their performance and their effectiveness. So I'll give you an example, and this is just one example. On the marketing side, we can see, centrally leads generated because we move them all into our digital environment. We can see where they stand from a search engine optimization standpoint, the effectiveness of their search engine marketing, where the majority of their leads are coming from through social media or other promotions, and therefore we can share it. I won't speak specifically to the practices, but you'll have a practice that's done well by their own right, but as soon as they start to see the data on leads generated relative to other practices in our network, they'll naturally gravitate to the strategies that we deploy to help with the aggressive growth. And those practices that are already in our digital environment have grown in the third quarter by over 28%, when the market at large has actually seen a net decrease in the third quarter. So just seeing the data allows people to align. And the way we approach it is we show them the data, and based on their data, they can decide how quickly they move to our platform or how slow they want to move to our platform. So I would say from a marketing standpoint, that's very specific. Schedule optimization. When you get doctors together, they will see how each other operates and what it means to have 2 or 3 ORs or 2 or 3 doctors, and how they can more effectively manage their schedule. So from a clinical standpoint, we can still protect quality, but they also learn how to optimize their practices and ensure they're still providing good quality care, but it allows them the opportunity to see more patients and change more lives. From a clinical quality standpoint, we measure things like readmission, right? We want to make sure that we provide care to the higher standard, and therefore we want to make sure that we're protecting the quality and the outcomes of our patients. And therefore, if we see someone that's got a high readmission rate, for example, then we'll make sure that we send out somebody else to sort of help them with that and ensure that they are deploying, top standard. I'm not a big fan of budgets, so I'm sure my private equity guys will see it. But what I am a fan of is gravitating everyone to the highest common denominator. So all of our targets internally are self-set, meaning if we've got our top quartile of practices performing at a specific level, that is our target for all of our indicators. So all of our indicators and standards that we set as far as targets go are self-set based on what we've already seen in our existing practices, not some artificial number that's handed to us. Roy, did I answer your question there?
That's really interesting. So benchmarking is defined by the best performer within the existing pool.
100%. And that's every category. Like I'll give you another quick indicator because I think it's super important. So to me, the fundamentals of a good practice are kind of, fourfold. Number one, it's are my employees engaged, my team members engaged? Um, when we actually partnered with our first five practices, our employee engagement rate was zero. So basically a balance of promoters against detractors. Today it's up 50 points, and we just released our third one because we want to make sure that we do three pulses a year on employee engagement. You have a really engaged team that feels supported by, support services, you'll get the result. Our net promoter scores and Google reviews have gone from an average of 4.1 out of 5 stars to over 4.8. So just, recognizing that as we have engaged employees and that increases, you'll naturally see higher NPS scores, Google reviews, and customer satisfaction reviews. Those are kind of the two fundamentals. The third one is, financial performance, which is kind of the outcome of just having a really strong operation and then having a strong set of doctors, right? Like the fact that our doctors get together once a quarter and share best practice around specific clinical items that just make them better doctors is certainly key to our success.
And are you taking on the entire plastic surgery market, or are you focused on certain procedures and certain demographics like high BMI patients that are looking for tummy tucks versus Boca patients that are looking for eternal youth?
I think all of us are focused on eternal youth, by the way. So let's start
Yes, but
there.
we're not all getting plastic surgery to achieve it.
No, 100%. But we don't have a specific I guess plastic surgery vertical that we're after. What we do want is board certified plastic surgeons that have a great reputation and that are open to learning and evolving. That's certainly key. It's not to say that we don't have a lot of proud plastic surgeons, and like any specialty, it takes data and information to reinforce that your strategies are working. And therefore, we rely very heavily on our advisory groups to help guide us. But we don't really have a specific vertical we're after. We do everything from, in some practices, high BMI patients, in others, a focus on, breast and body, and then others who focus on face, right? So,
Okay.
we don't try and evolve and change what the practices already do, but what we'll do over time is, add additional plastic surgeons that help round out our offering in each one of our practices.
Okay, so it's local market specific. And so there may be a situation where you're competing with Beverly Hills. It's possible.
It's possible. We do focus on not your primary big plastic surgery markets like Miami. We focus on more or less secondary markets,
Yeah.
i.e. Linden, which is 45 minutes from Salt Lake City, Jacksonville and Ponte Vedra, which is, just outside of Miami, right? So we try and stay away from those, those
So that is a strategy in itself. And
that is a strategy in itself.
my knowledge of Bill Heaton and his practices, that's been incredibly successful over the years down in I think Alabama.
100%,
Yeah.
100%. And
So
the difference between this and other specialties is people will travel to get the best surgeons.
yeah. So in terms of acquisitions, have you completed more since you formed the MSO back in 2023? Are some pending? Is that an area of focus, or have you really spent the first 12 months just solidifying what you have?
So we have done a couple of additional large acquisitions or partners, right, which we refer to them internally because they certainly are very engaged in a lot of our subcommittees. But we started with the first five, which also included two med spas. We did a couple more in the spring and summer, one in Ponte Vedra, Florida, just outside Jacksonville. They came with, three surgery centers, three ORs, and we are building out a fourth OR. But they had 6 locations and had a split of business 50-50 between med spa services and plastic surgery. And then most recently, We partnered with Tallahassee Plastic Surgery in Tallahassee, where we helped them build their med spa across the street from their plastic surgery practice. So we're solidifying what we have because it obviously takes time. We've got everybody on many of the same systems and have evolved there. So we can draw data, metrics, and share information with each of them to ensure that we're grounding our decision making in data. And that's taken some time. So we've been slow playing, adding partners. We've got a pretty robust pipeline of another 5 practices that we're working with. But we want to make sure that, they're the right partners. We've probably walked away from more than we've done. And if someone's just not the right fit for us, we're not afraid early on in the process to walk away. I think, you can do a lot of damage if you select the wrong partner to partner with the other doctors. So our doctors have a say on which other doctors join our organization.
And so operationally, what are you doing for them in the med spa space that they weren't doing before? What's that gap between before?
Well, I'd say a couple things. Number one, some of them may not have had them. So we just hired a director of non-surgical to really look at it. And that person, Jess Couch, comes from Ponte Vedra, where they've had a lot of success in the med spa area. And her focus is to ensure that every one of our practices has medical grade services and, not your typical spa of just, things like, massage therapy, etc. She wants to make sure that all services are medical grade. She's getting ready to launch, and in most practices has already launched a wellness clinic, which has been supported by our Chief Medical Officer, Dr. Bill Hedden, to sort of give a holistic view of someone's optimal best self, right? So, with the advent of a lot of the weight loss drugs and some of the other hormone therapies that exist out there, we want to make sure that we're putting support around that. So we are looking at additional avenues that really support the strategy around medical grade services for the med spa.
It's funny
And then,
how
of course, marketing.
these categories, they blend into each other before you know it. Wellness turns into longevity. Longevity turns into primary care. It's a continuum if you take it far enough. Yep.
It is.
So building on what you said regarding marketing, what would you normally expect to happen if you take on a small plastic surgery practice vis-a-vis marketing? What types of marketing strategies typically receive more dollars on behalf of the practice, whether it's word search optimization or Google ads? What type of strategies typically receive less dollars once you take over? Traditional marketing, billboards, event sponsorship. What would you normally assume is going to happen? Where are these practices underspending and where are they overspending?
Really good question. For us, there has not been, in most of our practices, a heavy focus on marketing, and therefore most of them generally come in with a very small spend in the marketing area. So that's, I would say, the first thing. The second thing, a lot of them lack savviness around the digital piece of the business. And, for the most part, all of our marketing needs to evolve to be more digital. It's easier to measure and gets to our target demographic quicker. And therefore, there's less measurement. Most of our doctors aren't looking at those metrics on a regular basis.
So they're light on analytics and they're probably heavy on radio.
Radio, newsletters, email campaigns, but then the data isn't necessarily rolled up to tell them whether or not it's effective. So the way we approach it is we leave and have added local people to every one of our practices because we feel like most of the marketing needs to be authentic. And by authenticity, we need to have someone local to support some of the social media initiatives and also help drive some of the search engine marketing piece. A lot of them also do events, and events have been a huge success for us and have shown a pretty strong ROI. but we leave a lot of the creativity locally. What we do is we roll up the data. Once they're on our digital environment, we can see what's driving the most amount of leads by market. We bring the marketing team together and we share, for example, which posts are driving the most engagement, which practices have the highest SEO or SEM, and we can both pull levers. So, for example, if we see one practice is, flat from a growth perspective, we can also pull the SEM lever centrally and also help guide the practice. So it's kind of a joint effort, but I do really believe that not having that local presence is doing a disservice both to the doctor and lacks authenticity. And that's kind of our model, is to make sure that we keep as much as we can local, yet driving some of the structure and driving our performance central by sharing information, data, and continue to evolve the organization. The things that we're doing less of is we're probably doing less. The things that aren't driving growth are things like advertising and publications is very weak. We don't do a lot on billboards and radios. We've evolved away from that and have started to really spend our money in the digital area, as well as doing local events, patient appreciation events, and really celebrating our patients. Those are the two things that drive the highest level of growth, as well as making sure that we localize our doctors by creating events in the community where our doctors participate, or attend events where our doctors participate. So those are kind of our three main focuses: is events, the whole digital area, and then the third thing is making sure our doctors are visible in the community.
Okay, that's very helpful. Give me an example of celebrating a patient. It's not a term that I hear used too often, but it sounds very interesting. What does that mean?
Twice a year, and by the way, this will be rolled out nationally, but twice a year, Ponte Vedra Plastic Surgery holds an event for patients where they all get an invite. We offer some discounting for services rendered. They can buy gift certificates, but it produces a ton of results when you celebrate them with some freebies, some discounts, and some opportunities to really get acquainted with all of the services of the practice. So it's huge. Twice a year. We do one in the fall, which we just finished in November at Ponte Vedra, and we do one in the spring, which is usually held in April. And that's one of the things that we're going to roll out across our practice, because we've just seen so much success, especially around gift certificates and prepaid services. And it also allows people to get acquainted with all of our services.
So is this an event where you're inviting prior patients to come to one location and hang out?
Yeah, 100%. And we also will do that.
Share stories amongst themselves?
100%. Share stories, meet the doctors, meet our estheticians, meet our injectors, right? Really get to know the team.
Yeah.
And I feel like we have the best doctors and team members in the industry. And as a result, they're very engaging. We did an event when we launched our med spa in Tallahassee. I was at that event, and there was a lineup down the block and around the corner just to get in, get some gift certificates, meet our doctors, meet our estheticians, meet our injectors, and to get in to see the facility. So I was quite impressed with the amount of traction of those events. And you'd be surprised at how many males actually come out. I would say like there's 10 to 15% male coming out to the event. So I keep thinking that eventually that becomes a huge opportunity.
All right. Note to self that I might attend one of those events. I always find the aesthetic space to be, forgive the pun, but aesthetically further ahead than some of the other clinical specialty groups that are out there. The practices are more appealing to the eye, typically. And I think the correlation there is the heavy focus on marketing, because it's always been direct, right? Direct relationship between the practice and the patient is defined and invested in because it's not referral based. So I think the other clinical groups that are increasingly interested in direct marketing could learn from the aesthetic space in terms of how it's done, especially with an MSO leader that's investing more and more in successful marketing strategies. I want to pivot a little bit to this question of organizing uniformity across the group based on best practice. I do think that's probably in your case more alchemy than science. And the reason is you're national, there's local market sensitivities, you're covering different patient demographic groups in different markets. So I can only imagine that on any given day, one of the practice leaders turns to you and says, Anthony, I know this works in Texas, but it's not going to work in Utah. I know this works with Dr. Heaton's patients, but it's not going to work with my patients. And I just wonder from a risk management perspective, from an operational strategy perspective, how do you balance uniformity and best practice with bespoke local market needs?
Yeah, it's good, and that's a good question. And I've worked in a couple of different environments where a lot of the marketing happened centrally, lacked authenticity, and was very canned. So I respect the local differences in each one of the markets. What we ask of our doctors is just to be open. So, last night we had an advisory meeting at 7:30, or it was actually at 6:30 to 7:30, where we went through the data, the results, um, performance of key marketing initiatives, and what we could do different. And I would say that over time, people become more open. So if I see my partner practice growing by, we've got one practice growing by 41%, the questions always come up. So I still believe you can still ground it in data, and we can point to the social media posts, what we're doing different from a search engine optimization standpoint. And we try and encourage the practice to try it, right? We can always go backwards. And I would say we've got a really great set of doctors that are really open to it. And then over time, what we've seen is people asking for it rather than us pushing it. Because my reluctance to push is because I want to make sure that we show respect for the doctor and the success they've already had. You know, it's easy to be egotistical centrally and believe that you've got, the right formula and everybody should follow it. But without the buy-in of the doctors, nothing happens. And that is one thing that I'm very cautious in protecting is the local input piece. And that's why in some practices we've added a marketing manager to make sure that it's protecting kind of the local look and feel while still understanding and deploying some of the strategies that have worked to really create increased followers and results ultimately. I don't know if Roy, if I'm answering your question there.
I think you're doing it perfectly. Just in a business that doesn't believe that it lends itself to perfect uniformity across the country, push as little as possible and have the physicians do the pulling instead.
That's right. Like and it's been amazing. I mean, the one area where I would say we took a lot of time to do is bringing everybody on the same common EMR and garbage in, garbage out, right? So I can move everybody to a common system, but if they enter procedure codes very differently, then it's going to be very hard for me to share, which services produce the best results. And our chief operating officer brought the doctors together in his advisory group, landed and took down the number and the renaming of services from 3,000 to about 300, right? That'll allow us to show growth in each of the key procedure areas, allow us to share which have the highest margin, which is driving the most growth. So we can share that with our doctors. If we don't have a common set of information, then it's really hard to do in any area. Same thing with risk and compliance, right? We are coming up with a common set of indicators around risk and compliance. They'll have to be entered the exact same way. I am always cautious that I don't want to overburden the teams, but I'm also very sensitive to the fact that risk, compliance, and quality have to be the cornerstone of everything we do, and we have to benchmark some of those factors as well.
Talk about patient feedback. In your category, word of mouth is a primary driver of new patient growth. Existing patients speak to new patients and they come.
Well, I'd say
in your category, patient feedback is acutely important. I mean, it's important everywhere, but it really is beyond referral source feedback, the primary driver of growth. So I would imagine that just a Google satisfaction score is not enough. Where else are you going to understand your patient feedback and to participate in the discussion? Is it patient Facebook group chats? Where are you orchestrating the right kind of conversation regarding your physician group?
Okay, that's really, really good. So we do it in four different ways. So first of all, Google reviews tell us something, but not everything, right? Um, Net promoter scores tell us something, but not everything. And from a net promoter score standpoint, we're standardizing all our customer or unifying all of our customer reviews. We want to see that those not only locally but centrally, because that'll tell us whether or not someone is recommending our clinic or not, and if there's something that we can do different.
And those are
And
gathered
then
on site, day of service, fill in the following
the,
survey.
they are gathered on site right now, and for the most part, very paper-based. We are going to work on automating that on a link so the practice can see it and it's not as burdensome, and we can see it centrally. Right now, I can see centrally all of our Google reviews and our Net Promoter Scores real time. We just need to make sure that we ask a handful of questions that get at the quality of care and the customer perception. And one of my beliefs is perception's reality, right? So I've often heard this in my 30-year career where people say, no, we're actually doing a really good job. I don't know what this customer's talking about. Or, support services feels like they're supporting the practices, but someone's complaining. I'm like, well, perception's reality. If they believe that, that's the true fact, not what you believe that you're doing, right? So you got to be super sensitive to that. So I would say customer reviews. We do get some information from Facebook chats where it's appropriate. A lot of the chats are closed, but we do get a sense of, what people are saying about us, a lot of the mommy groups and mommy chats. And for the most part, where we have, you know, team members' wives on those chats, we have a formal advisory group that actually tells us what's happening in each one of our practices. So we can keep our finger on the pulse, which is more nimble than it is, scientific to your point. And then I think the fourth thing is I really believe that, ENPS scores tell us a lot, right? We measure complication rate and adverse events, and that'll be systematized across the platform because if you're getting, a ton of complication and revisit rates, then that gives you an indication of the type of quality that you're providing to patients. And that's where we need to be, is positioning ourselves as a high quality provider of plastic surgery and med spa services.
Recruiting has been an area of weakness in the category. Most of these practices have really struggled to find other plastic surgeons because they are in tiny supply relative to other clinical groups. Where are you investing there to strengthen your recruiting effort? I would imagine that as an MSO, a national leading MSO, your recruiting should be better than everyone else's. What does that practically mean, better than?
That's a really good question. So just let's start October 23rd or 25th, whenever we started. Our first order of business was also to hire a director of recruitment and doctor recruitment and engagement. And for me, it's two things. Number one, I got to make sure that my doctors are happy and believe that they're getting a great experience, and we're celebrating all of their milestones. So one of the key orders of business is let's start with our existing doctors so they could share their experience with external doctors, which I believe to be very strong, and celebrate key milestones like anniversaries, days they joined, birthdays, right? Ensuring that they have an ear to lean on when they need to access somebody. I also expect my senior management team to be available 24/7. If someone calls you, call them back right away, make sure you're addressing their concerns. So I think engagement of your existing doctor is first and foremost. The second big piece for us is, the fellowships and ensuring that those that have a fellowship program share with us what they do and how they do it. We're developing a standard for entertaining new doctors coming in, and that standard includes things like come in and meet the teams, having dinner with our doctors, making sure that we send them gifts afterwards, and we continue to stay in touch with them. We also have created a very specific path to partnership. So if you join our practice, we will show you that how over time you'll become a partner that'll be sponsored by us. Many of them come out with, a ton of debt. So we want to make sure that we create that path and minimize the impact of their investment in growing their own equity. We also take, the risk away from them. So if, we can get a doctor to agree to join us based on their experience going through the interview process, then in many cases, we'll help them with their student loans. And we're just in the process of developing a benefit for them, which allows them, to accelerate the payment of their student loan, which we are helping to sponsor. So all things are in the works because I feel like, a lot of these guys come out with $400,000 or $500,000 worth of debt. So if we can be first to the forefront and help support them around paying off some of that debt and then helping them accelerate that based on their loyalty to the platform, I think we'll get, that investment will yield returns 5, 10 years from now. So, we're consistently looking for innovative ways to attract people, to create partnership opportunities and help them pay off their debt. And then the third thing is making sure that, we use the schools that many of our doctors come from as kind of the basic recruiting ground, right? So, where are they affiliated? Where do they teach? And how do we attract people to our practices? And using their relationships to ensure that we're deep into those schools and those plastic surgery schools that we can start to listen and develop a relationship. So it's, more or less relationship management, but it's making sure that we appeal to their need right now, which is, hey, I want to make sure that I become wealthy as I gain more experience and I have an opportunity to be a partner, but it's also making sure that I get to take care of my school debt, as if I join the practice.
Thank you. That's very helpful. What about the future of the business 5 years from now from any perspective you want, but I'm particularly interested in two areas: strategic partnerships, expansion into new areas. Maybe dermatology in the past has been a bedfellow of plastic surgery. And then from another angle altogether, technology. How will technology impact the way that you do things between now and the next 5 years? So just go about that any way you like. If I've missed something that you think is going to be a key driver of change for you, let me know.
Our primary objective is to make Ascend Aesthetic Partners the most exclusive network of plastic surgery and aesthetic centers across the US, starting with the Southeast. So we have no plans to get into other specialties at this point in time. So it's really focused around plastic surgery and med spas that are medical grade services associated with a plastic surgery clinic. We will never partner with just an aesthetic center without it being plastic surgery led. So that's number one. We are committed to that. And I always hang my hat on our surgeon in Linden who said to me, Anthony, I just want to keep it classy. There are a number of different types of plastic surgeons out there. Some of them that call themselves plastic surgeons that don't have the same level of education and background. We want all of our surgeons to be board certified from the right board, which our chief medical officer can speak to more, but that is our primary focus is plastic surgery. Where do I see us in kind of the medium term? Our focus is primarily in the Southeast. We want to ensure that we've got enough support resources at our MSO to be able to reach every practice. It's not to say that we wouldn't, expand into other parts of the country, but we need to make sure that we continue to have confidence around the leadership of that physician. We've looked at other practices. Like I mentioned, we've walked away from more than we've done because we want to make sure that we feel like there's strength in that collaboration and that person is respected in our community.
I would imagine plastic surgery egos, by definition, mean that you're picking up the minority, not the majority.
Well, yeah, and I would say, and it's
even
not a
amongst
race.
doctors, those egos stand head and shoulders above all others.
We want them to have a great reputation, but not to have a rock star mentality. I don't know if that makes sense to you, Roy, but I would say all of our physicians or surgeons have a lot of pride and are well regarded in their communities. Most of them have built their practices on word of mouth. We're just helping to supercharge that, and that continues to be super important for us. But what we stay away from is rock star plastic surgeons who don't believe they have anything to learn and are focused only on money, right? I think that's um, in healthcare, something that, I prefer to stay away from is someone who's just focused on money, but it's got to be on, evolving the specialty and ensuring that we ground ourselves in quality providers.
And that's really probably what fuels the primary skepticism against consolidation. What most private equity groups would probably point to and say, well, this is the reason why this won't work, can't be done, is the blanket statement that all plastic surgeons have rock star egos. When you and I both know that, the contrast in personalities is as extreme as you'll find in any other industry. There are team players that just haven't formed teams yet, like Bill Heaton, perfect example. And then there are uber egos that will never form a team, or once they do join one, won't last. It's just like anywhere else. So I wanna leave it open for the rest of the group to ask any questions that I might have neglected to ask. So if anyone has anything that they want to pose to Anthony, please feel free to do so.
Hey, Anthony, this is Jim Minovich. What's the breakout between cosmetic surgery versus, medical necessity for your practices?
The percentage is roughly 90% cosmetic, and I'd say 92% cosmetic and about 7% medical necessity.
And so, are you using AI in any way to paint a picture for them from a customer satisfaction standpoint post-surgery?
You know what? It's interesting that you say that. We're just evaluating right now. So our 2025 plan is to make sure that we embed some AI into what good practices look like in every area. So we don't have anything today, Jim, but it is our plan in 2025.
Okay. The reason why I ask is because on the patient's satisfaction, the Net Promoter Scores, are you getting dissatisfaction from when you see that dissatisfaction? Because it wasn't established on the front end, and and the back end caused the problem. I'm just curious there because I live in Ponte Vedra and I see a lot of your work. I know people that use the clinic, and so most of it's good. But I see some others that aren't in the area that aren't so good, and so I'm just curious to see like how you could avoid it in the front end.
Well, on the front end, that's a great question. So first of all, it's making sure that our doctors, even in recruitment, we will always bounce who we add to our company off the doctors because we've walked away from more based on our doctor's opinion because they really want to make sure that we keep it classy and we keep it grounded in in quality. The thing that we do post is we look at our revisit rates, address it with the team, and we are actually adding quality and compliance team that will visit each clinic and make sure that we're not just at standard, but we're above standard, right? In every aspect of quality, compliance, and risk, right? So we can get ahead of it. A lot of the complaints, if there's any, come from, I would say, bedside manner, right? I just don't get along with the doctor, or I didn't like his approach, right? And therefore, we share that feedback. We also share employee engagement scores with them, right? To make sure that they get a sense of how their teams feel about them and how they feel about SSO. So I don't know if I'm answering your
No,
question,
you can
but
answer that. I mean, and the net promoter scores that you said went up. Is the question? Would you refer us? That's
that's
the
right.
main. Okay. All right. Well, so you kind of figured out why they've gone up, right? You've got the metrics to understand that, right? And to keep measuring it and to improve on it, right?
100%. And I would say even on our ENPS scores, our employee net promoter scores, I know people have told me that, hey, you're overkill on this. You want to do it 3 times a year. I do it 3 times a year because we get, first of all, 80% participation in those surveys. But I also want to make sure that we keep our finger on the pulse. We've got some practices that are not performing as well as others. And not only do you see it in their employee engagement, you see the same thing in their net promoter scores, which in turn leads to the same thing from a growth perspective. when a practice is healthy, all things are firing on all cylinders, and they all know it. Now, we're very sensitive in not sharing negative information with the practices. And therefore, we keep a lot of the ENPS, specifically the ENPS scores, employee engagement scores, one-on-one with the doctor and their teams and not to the entire group.
Thanks thank you for answering my question. You did great. You
Hey,
kind of, I had a bunch of gray in my head, and you you cleared it up. That's really cool. Thank you.
hey, no problem. Thank you.
Any other questions from the group?
There's a couple in the chat, by the way.
No, thank you.
Hey, Anthony. This is Mark. I'm actually in Atlanta. And the question on AI was one that I'm very interested in because I'm planning a symposium in late January on using AI in your medical practice because we focus on independent practices and different innovations, just like I know everybody on this call does. Are you looking at any other programs on how to implement, like on clinical pacing, EMR integration, just day-to-day activities?
This year has been foundational for us, right? So putting the base infrastructure in place, make sure information is entered in the system the same way across all of our practices, make sure, all the fields and the categories align. We use ADP for payroll. Our EMR system is consistent across our group now with all of the entry going in the exact same way across our practices. We haven't looked at AI yet. I'd love to see more about your symposium, by the way, or integrate it into our practices. But the goal of getting at least the base done is so we can start to be more predictive in our approach, see where the market's growing, and ensure that we target our recruitment, our growth, and our quality around the same kind of areas that look to be the fastest growing. Mark, I don't know if I answered your question.
No, you did. You're kind of where just about everybody is. You know you need to enter the door, let the monster in, but you're not quite sure how to handle it yet. So that's good. Thanks.
Well, ChatGPT is my best friend, so I don't know if that counts, but it's definitely where I go to get my base level information.
Anthony, you and I will have an AI conversation today. Promise you. We'll get you further than ChatGPT. I wanna speak to Tom's question in the chat group. How strong are the synergies between med spa and plastic surgery? For example, do patient acquisition costs come down for med spa based on successful acquisitions in plastic surgery?
Yeah, so great question. And I'll answer it honestly. I don't know. So anecdotally, this is something that all of our surgeons believe is that the cross referral of services has a huge impact. Once I get our systems in place and we start to tag our patients across their area, I'll be able to see what the uptick looks like on our patients and whether or not that has any impact on patient acquisition. Just anecdotally, I feel like the team believes that if done properly, it brings down the patient acquisition cost to almost zero. It's one of the reasons why we think events work, is because whenever we run an event around our med spa, for example, we see a natural uptick in surgical services as well. The challenge I have is that we're not capturing any of that data in the system. So everything I feel I get right now is anecdotal, but it is part of the plan heading into the second part of 2025, once all of our systems are in place. So I can't answer your question accurately. I could just tell you that there is a belief out there that I can't ground in data. And as you can tell, for me, in order to make a case, I always like to have the data. Otherwise, it's really hard to get it supported by our doctors.
Tom, was that helpful?
Yeah, it was very, very helpful. Thank you. And honest. Appreciate that. Yeah, I mean, it makes so much sense, right? But the proof is in the pudding.
It is.
Don't use the
And
word
everybody
pudding here, Tom.
everybody gives you their opinions on stuff, as you're doing diligence. But unless I could tag a patient and see the life cycle of a patient all the way through, really hard to see. I can tell you that patients that start, for example, with mommy makeover, kind of in their late 30s after they've had kids, almost 65% of the time come back and do other surgeries later, right? So that piece I know. Piece I don't know is kind of the whole flywheel piece on, does wellness impact med spa and does med spa impact plastic surgery and vice versa?
Thank you. Okay, I wanted to thank you, Anthony, for your time this morning. It was very insightful into a really fascinating space that's going through transformation before our eyes. I think we're getting an early look into the future of plastic surgery, and you're leading the charge. So really applaud your efforts and your success, and look very much to staying in touch with you. Thank you.
Thank you very much, everybody. Thank you for taking time out of your day.
Have a great day.
Thank
Bye.
you.